Ward with the Washington Health System. My honor to be back with you again today for our Friday video series to give you a number of updates, and I have a number of them today. Starting with a win. As many of you know, we have a great OB/GYN service for women of all ages. It's been amazing for years, and we've been trying to improve it to make it even better for you. We recruited new docs over the last couple of years. The practice now is up to 8 physicians, 6 female, 2 male. They're tremendously talented, smart individuals who are providing great service to our counties. They have 5 locations between Washington and Greene counties, so you can get in at pretty much anywhere you'd like. On top of that, we have great staff both at the outpatient offices but in the inpatient department as well. And we just completed a $7 million renovation of our inpatient OB/GYN department that happened in the middle of COVID. It finished up in the middle of that. So we didn't get a chance to promote it. Now that unit is called the Washington Health System Care Center for Family Birth and Women's Health. It's a $7 million project, and it's so nice. We had 4 healthcare design publications promoted. They are the Healthcare Design News Release, the Healthcare Design Photo Tour, Medical Design and Construction, and Healthcare Facilities Today. All 4 of these organizations have identified and recognized our inpatient facilities as being top-notch. So I just wanted you to know we're very proud of it. We have great physicians, great staff, and great facilities. We're here to take care of you now and into the future. Switching gears then, I want to talk about COVID. I want to start with COVID testing. Nationally across the U.S., the testing rate of people who are positive is about 8.75%, and thankfully we have not seen a rate that high in this area. Since the beginning of April, in-house on our in-house testing, we've tested a little over 2,600 people. We've also sent a little over 5,300 tests to Quest. Combined, we're seeing an in-house positive rate of about 3.2%, and the tests to go to Quest at 2.6%. Now you might ask, why are they different? Well, obviously we're running the ones that we think are most acute, most important internally, and we're sending the rest to Quest. And so it would make sense that our in-house testing would be slightly more positive. But it's a far cry from the national rate of 8.7%. On our in-house testing, we can get those results back sooner. We're testing inpatients, ED patients who are going to be admitted, some healthcare employees who might have been exposed, and patients who are getting discharged to a nursing home. Otherwise, all patients that we screen are being sent to Quest. We do have 2 outpatient testing centers still up and operational. One is at Wellness Way, the other one's down at the Washington Health System Greene. They're both operating Monday through Friday from 8 to 4. You need a physician order in order to have the test. Both locations, you drive up, you do not get out of your car. At the Wellness Way Center here in Washington, you just drive up and there's sort of a drive-through lane. At Waynesburg, you would pull up to the sign, call the telephone number on the sign, and the staff will come out to you. And we'll take care of you without you having to leave the car. The turnaround time, unfortunately, is the bad news. For Quest, their turnaround time today is about 10 days. It's been worse. It's been up to 16 or 17 days, so 10 days is better than that. But it's not as good as it was 2 or 3 weeks ago when it was running around 48 hours. So we understand there's a delay. There's not much we can do about that, but we wanted you to know that we're monitoring it and keeping an eye on it. Now I want to talk about the number of COVID patients we've had. We have not seen the rush or the increase in COVID patients like other parts of the country over the last month, but we have definitely seen more positive COVID patients go through our testing center and be admitted than we did the prior 3 months alone. And on average, over the last 2 or 3 weeks, we're seeing at both Washington and Greene 2 to 3 inpatients per day in our facilities. Now, we've had as many as 8, and we've had as few as 0, but our average has been 2 to 3 at each of those locations. It's very manageable. We're taking care of it. We have a wonderful team of physicians and staff here who are taking care of these folks, and so I don't want you to think we can't handle what's happening in our area, because we can. Now, you can help by keeping those numbers down. The way to do that is to continue to social distance, continue to wear your mask at all times when you're out in public, and remember to use hand hygiene whenever possible. Now, one of the early concerns during the outbreak of COVID in the United States was the availability of PPE, and I wanted you to know that we have enough supplies. We are being very conservative with the use of our supplies, there's no doubt about that, but we have a sufficient supply. Currently on site, in our stock, we have about a 60-day supply, so if we needed it at our current burn rate, and we have another 60-day supply on order, assuming it all arrives. We have had some product taken by FEMA to be redistributed across the U.S., but that has not been a huge problem. So we're in good shape from a PPE perspective, and you can help, again, by social distancing, wearing a mask, and remember to hand hygiene. Visitor policy, switching gears here. You might recall at the last video I gave you an update, and that policy is still in place. So at both Washington Health System Green and at Washington Hospital, we're limiting visitors now to one visitor for a patient per day. We're not allowing visitors to swap in and out. One person, the same person, can come all day. Now it can be a different person tomorrow, but one person per day. We're screening those individuals at the door, instructing them on what to do, giving them instructions, but we're not taking temperatures at the door. And we've had a lot of people ask why we're not doing that, and I want to answer that. Early on, we were taking visitor temperatures, and we had screened literally thousands of people. And the fact of the matter is, it didn't make any difference. You had people who were COVID positive who didn't have a temperature. You had people who had a temperature who were not COVID positive. So it doesn't make any sense, and we stopped doing that. But we are screening you for signs and symptoms, making sure you have a mask. You are required to wear a mask, giving you instructions about where you're allowed to go and where you're not, and we're going from there. We do have some restrictions. There are some inpatient units who are not accepting visitors for the safety of those patients and our staff. And there are some areas where we've left it to the discretion of our staff based on the condition of that patient. Those areas would be the surgical departments, the emergency department, ambulatory care, and some of the outpatient procedures. So we want to keep you abreast on visitor policy, but that's where we stand today. Switching gears then, I want to talk to you about a whole new program we just launched here recently. It's called the Washington Health System Lung Screening Program. This is basically a low-dose CT scan looking for lung masses or nodules in high-risk patients. And what we're trying to identify is cancer long before you have symptoms. And so it's been proven to be successful across the country. Most, if not all, insurance companies pay for it. And we think it's a great service we're going to bring to the community to help identify lung cancer before you were really sick. Now, there are some eligibility requirements. Patients who would be eligible for this would be patients between the age of 55 to 77. They have to be someone who is greater than a 30-pack per year smoker. They have to be either a current smoker or someone who has smoked routinely at that 30-pack or more per year level within the last 15 years. And they have to have a shared decision-making conversation with their primary care physician or a specialist about whether this is the right thing for them. Part of that shared decision-making conversation includes the risk and benefits of the screening, the follow-up diagnostics that's going to be required, the possibility of overdiagnosis, the radiation exposure, of course, that comes with a CT scan, their willingness and ability to follow up on the diagnosis and the treatment if one is needed, and adherence to annual screening. Now, included in this would be smoking cessation that would happen at the physician office. All of that's required for the program. If you're interested in this and want to be screened, you can start by calling our lung screening navigator at 724-250-4594. We think it's a great program. It'll help identify cancer early and help save people's lives. Last topic I have for you today is our parking. As many of you know, if you've come to the Washington Hospital for years, we have a coin-operated parking system where you have to pay to park. That system is extremely old. We're struggling to get parts for it. It's breaking frequently, so we are going to switch to a ticket-based system like you would see at many other organizations. You drive up to the gate, you get a ticket, you come into the organization, do what you want to do, and then when you leave, you can either pay at a pay station at 3 different locations in our building, one in the ED, one in the main lobby, and one will be placed down on the G level, or at any of the gates as you drive out, you can pay with a credit card. So the only reason you would need to go to a pay station is if you wanted to pay with cash. We think this is going to be more convenient, it's going to be an up-to-date system, and it's what you're used to using everywhere else you go to pay to play. Now, we're going to stop giving away free parking. Many of you come to us for lab draw, x-ray, some minor procedures, and we've given you a token in the past. We're not going to do that. But I have good news. In the old system, it was $3 for the token. With this new structure, for the first 70 minutes, your parking will be free. So you can come in and still get that x-ray, the lab draw, pick up your medical records, and get your parking free. The second hour after that would be $1. The third hour would be another $1, all the way up to $4 maximum for the day. So we think you're going to like the system. It's going to function much better. You obviously can come in for those short visits and still park for free. But for those people who need to be here a little bit longer, we think the pay for parking is manageable and a reasonable request for our system. Now, I understand there's going to be some hurdles and some bumps with getting this go live, so I apologize for that. I know it'll be a change, it'll be different, but we'll all adjust and we'll get used to it. And I appreciate it. I wanted you to have a heads up. We're expecting this system to be go live around September 1st. and we hope you enjoy it. Last topic I have for you is, like many organizations, we're looking for skilled and talented labor, and we're struggling to find that right now. So if you're looking for a job, we have lots of jobs, everything from entry level all the way up to highly skilled nurses, radiography techs, pharmacists, and doctors. But we're looking for people at all levels. So people who want to work in environmental services, phlebotomy, med techs, you name it. The way you can look at jobs would be going to our website. It's https://whs.org/careers. Please check it out. We'd love to have you on our team and have you join our family. We think it's a great place to work. We think you'd find it would be as well. Those are my updates for this Friday's video. I hope you found them informational. I hope you found it useful. I appreciate your time and attendance. Until our next video on August 21st, stay safe.